On behalf of the Arthritis Foundation, Great Lakes Region, to the final webinar in a series designed to provide each of us tools for becoming more effective advocates. This is our third webinar in the Advocating for Access in Your State series. State Issues in Hot Demand, the Constituent Advocate. I'm Pam Fields, Director of Public Health Policy and Advocacy for the Great Lakes Region. If you're interested in putting those skills to work that you learned today, I'd love to speak further with you. My contact information will be available at the end of the presentation. Our presenter today is Starla Tanner, Specialist, Government Affairs for the American College of Rheumatology. Starla, I turn it over to you.
All right. Good morning, everyone. Thank you, Pam, so much for allowing me to participate in the very important work that you all do by providing this webinar. I think two voices most often heard by elected officials are donors and constituents, both extremely important and both have value. Both voices know the issues and both voices know the process. So I'm sure that some of the participants today may already have some experience with advocacy, but I look forward to providing a few tips and information as we all continue our work. Before I get started, I just wanted to bring you greetings from our president for the American College of Rheumatology. We've recently increased our advocacy at the state and local level, and I've personally hit the circuit in many states, including some of those that are on the call today, working with Pam, to talk about the importance of advocacy at the state level, not just at the federal level. So we're very appreciative, and he is appreciative of the efforts that we do combined with those of the Arthritis Foundation. And the last kind of housekeeping thing and acknowledgement I'd like to make is acknowledging the Arthritis Foundation. The American College of Rheumatology and the Arthritis Foundation are founders of a national coalition. It's the Coalition for Accessible Treatments, and we've been working on the federal level. We've now begun working as a group on the state level as well, advocating on behalf of patients and providers. We are the authors of the Patients Access to Treatment Act, otherwise known as PATA. We have over 200 sponsors, and we're continuing to work with this effort as long as in addition to the other organizations that you see on your screen. So again, thank you, Pam, for this opportunity, and thank you overall to the Arthritis Foundation. Today's brief presentation will include really three topics: the importance of advocacy, some of the key issues, and then some tips for successful advocacy as we continue this work. It's election time, so we're seeing lots about politics on TV, but advocacy is not just what you see on TV and those commercials against the candidates. Former Speaker of the House, which some of you all may be familiar with, Tip O'Neill, is quoted as saying all politics is local, and he meant it in the incorrect grammar way that he said it because it was a singular issue. Politics are local. Just really quickly, some background on that quote about politics being local in relationships. When Speaker O'Neill was campaigning, it was important to him to find ways to relate directly to his constituents. In 1982, when he ran, he made the fact that his opponent received sizable contributions from the oil industry a really big issue because he knew that his constituents, his neighbors, the people that he knew in his state and in his town were suffering from high oil prices and a poor economy. He went on to introduce a $1 billion jobs bill. Again, he made the issues local for his campaigns, and that's what we want to do. We want to be the constituent advocate, a real voice to raise awareness and reduce the unacceptable impact of arthritis. Here in this picture, you see hundreds of people there on Capitol Hill. Maybe some of you are in that picture because it includes people from the Arthritis Foundation, from the American College of Rheumatology, from all over the country, spending time advocating on behalf of important issues. So what's the constituent advocate? Most of you know that. A constituent is a person who lives in an area, they're a member of a group, and then an advocate is a person who argues for or in support of a cause or a policy. But really, who's the constituent advocate? Where is the constituent advocate? Everywhere, everywhere. It's the neighbor behind the fence. It's the moms in a park, your grocery store. You're the constituent in houses of worship, in churches, in school groups, community groups. Constituents are the best to work on important issues, to actually get through to elected officials, especially legislators. Because as you'll see on this slide, there's a lot going on in a legislator's brains. You have contributors, the donors that I mentioned before, that are giving money, that want to be able to share what's important to them. You have the legislators' own life experiences, how they relate to public or private school, depending on where they went, or if they have if they're a caregiver for a parent or for a child that has a critical health issue. Those life experiences play a role. Other lawmakers that are talking about what's important to them. Their staff certainly in their ear, talking to them about policy issues. They want to become reelected, so their campaign is somewhere in their head too. Their political party's platform, what's being said in the news and media about issues or about them. But right in the middle are the constituents, are the voters, and they're listening to us. They're listening to you. So we want to cover a few of the issues that we can talk to them about and how the constituent advocate can tackle taking that space in their brain so that they're listening to them. Four of those issues are ones that Pam and I have worked on together and her colleagues in the Arthritis Foundation across the country: standard prior authorization, specialty tiers, step therapy, and biosimilars. So we're going to talk about those four briefly. I know that in the past, the Arthritis Foundation has done some really good work and provided webinars on these issues that are probably still, if I'm correct, Pam, still available on your website if you want more specifics than what we're going to cover today. So on standard authorization, we're usually advocating for proposed legislation that would shorten and simplify the process to receive authorization from insurance companies. As you'll see here, we're really fortunate that there are a lot of states that have tried to tackle or in the process of tackling this issue for the constituents. Happy to say that Pennsylvania and West Virginia are two of those states, since I know those are two areas in the Great Lakes region. As a constituent, your story on this issue would provide a picture of what this actually looks like. So you would tell a legislator what waiting for your doctor to get through a thick process of papers from the insurance company, how does that affect you? That's delaying your ability to have your procedure or to receive your medication. Being able to provide that specific example is something that a constituent can do for a legislator. The second issue are specialty tiers. We're seeing proposed legislation across the country that would place a limit of $100 to $200, maybe even less in some states, for copayment or coinsurance. States with recent legislation are listed on your screen. It's been a very busy year. We're excited to see that Louisiana and Maryland passed legislation dealing with this issue. And there in Pennsylvania, you will have a study bill, which means at least legislators are looking at the issue and tackling it there in your state. Here's what this looks like for the constituent advocates. When Ms. Smith, who works at the local bank, sees Representative Long at church most Sundays, participates in the Arthritis Foundation's Ohio Legislative Day with her rheumatologist, and she goes by Representative Long's office and she talks to him and says that even though she has a job at the bank and insurance, that she still can't afford her medication. When she shares that with him, when she talks personally about her experience and how much her medications are, and Representative Long knows that this is a valuable member of his community, it becomes a real issue from a real person for Representative Long. So another issue that we're working on, step therapy. The proposed legislation we're seeing limits the ability of insurance companies to require specific treatment for conditions if the patient's doctor recommends an alternate and sometimes more costly option. Representative Kay there in Kentucky was very helpful this past session in introducing legislation, and we're looking forward to continuing to work on that. So here's a case example. Representative Green sees Susan, a former high school classmate, at the grocery store. In fact, she may have played flute or something, or instrument in the band with him while he played trumpet. Susan is now in a motorized cart. So Representative Green asks Susan how she's doing, and she explains that her health was fine, but it's now declining because her new insurance company is requiring a change in her treatment, despite her doctor's previous treatment orders. But the new company requires a new process. Representative Green now has a picture, and he's ripe for the next session when Representative Kay or other stakeholders begin to talk about the importance of limiting step therapy. Susan has been a great constituent advocacy. The last issue very quickly that I want to mention are biosimilars. Biosimilar bills would require that a pharmacist notify the prescribing doctor if a biologic prescription is changed to a biosimilar. Lots of folks mention that this is similar to the generic drug issue, but it's not. It's different. You'll see the states listed below have been working on this issue. There in Pennsylvania, we had Senate Bill 405 introduced, and we had several states that have enacted legislation. So let's just say we have Senator Moore, and Senator Moore sees Mrs. Harris. Mrs. Harris is his retired neighbor from down the street. She's a former school teacher. She asks him if he's seen all those ads for new medicine, and then she tells him in her teacher voice that her doctor needs to have the final say to make sure she's on the right medication, and that if anything is switched, her doctor needs to know about it as soon as possible. That's a real person. That's a real story. That's a constituent that's made it a real issue for Representative or Senator Moore. So when he sees that legislation come up, he's aware of what it might mean to someone in his community. So we talked about the issue some very briefly and the importance of having a real person talk to legislators and elected officials about the impact of the laws that they're considering or passing. But understanding the process is also important. I grew up watching Schoolhouse Rock and definitely singing that I'm Just a Bill song, and it gave me an idea of the legislative process. And Bill looked so sad at times when he had to go back and forth, but in the end, it showed that the process was a process that you had to know and get through in order to make a difference. Now, I know we have about 4 states represented, and I wanted to quickly give you just an overview of your state legislative process and at least the terms of the session so you could know the time frames that we're talking about. In Kentucky, and Kentucky has those beautiful flowers in their picture, they convene on the Tuesday after the first Monday for 60 days in even numbers and then 30 days in odd years. Each session must conclude by the 15th, April 15th in the odd year, and by March 30th, in the odd year, and April 15th in the even year. What's important to note is this is a very short time frame in order to get legislation passed. So the pre-work, those conversations in the grocery store and in different sessions are important in establishing that relationship with the legislator so that when the session begins, they're already aware of the issues and they can work quickly to have them passed. In Pennsylvania, you have a full-time legislator. So it's a round-the-clock and calendar opportunity to engage with your legislator. In Ohio, their legislature convenes the first Monday of January in odd number years, and then they continue any work that's left over in the next session. And then in West Virginia, that body convenes the second Wednesday in January for only 60 days, and then the second Wednesday in years when the governor's been elected so that the new governor has time to put together his budget and his profile. So it depends on what state you're working in, the time frame, but in all of those, it's important to know the legislative process. And while there are some small nuances on the specifics, the basics are the same, that you have an idea that's introduced, or it's a solution to a problem from Susan that runs into Representative Green or someone else, or maybe it's an industry that brings an issue there to a legislator, but you have that issue represented. The bill is then read in once it's drafted by the legislator and by legislative staff. It's read into the body. For example, if you have a biosimilar bill and Representative Johnson introduces it, it's read into the House of Representatives. It's then sent to a committee hearing where the members of that committee, health committee a lot of times, or the insurance committee, hears the issue and they have an opportunity to debate the bill or amend the bill. Maybe in the case of a biosimilar bill, it's shared with them that a prescriber communication provision or language needs to be added, and the bill is amended to include that. It's then sent to the full body in the House, where it's read a second time and voted on. They have an opportunity to amend or not amend, and then it's read a third time and they're voted. They voted on the third time and they voted out of the House, and it crosses over into the Senate and goes through the same process again, with going into the reading, then the committee hearing, amendments or not amendments, the second and third reading. If the bill isn't changed once it's crossed over, it's voted out by the Senate, goes to the governor, it becomes law. If the other body makes an amendment to the bill, then it has to be sent back over to the other side of the House or other chamber for them to either agree to the change or not agree to the change. If they do not agree to the change, then it's sent to a conference committee where they debate out the differences, and then both bodies voted up or down. So keep in mind, in some of our other states, where this is just a 30-day process for them to hear all the bills and do this with every type of proposed legislation, or when there's a 60-day process, or when there's a full year-round legislative session. So it really does depend on the state as far as how much time you have for this entire process to take place. And again, if at some point the bill does not continue to proceed or does not cross over, and we'll talk about that a little in legislative terms, then you may have to start over from scratch in the next legislative session with the issue. So I hope that was a quick and easy to understand overview of the legislative process. I think when Schoolhouse Rock did it, it was definitely more fun to listen to. So speaking of fun, I thought I'd throw out some legislative slang or terms for us to talk about. You hear a lot about caucuses and the slang legislative cliques. That's really, there are many different caucuses that can be in each state legislature or even in Congress. You have the Women's Caucus. You certainly have your partisan caucuses for the Democratic Party, or Republican Party, or Libertarian Party. Even in Congress, they have an Arthritis Caucus. So to the extent that you find out about the caucuses and who the members are, and you can create a relationship with them or some common interests, that's always an opportunity as well. And then, of course, there are the committees, like I mentioned. The Health Committee and Insurance Committee are two of the most important committees in the advocacy work that we do. I've jokingly called them voting cliques. But in addition to the substantive committees, it's important to know that some of them are standing every session committee. Some are joint committees that are composed of House members and Senate members, and then at times special committees if there's an issue or an initiative that's being worked on in a state. A special committee may be created by the legislative leadership. And then there's crossover, which I refer to as a legislative 50-yard dash. When I mentioned before that the bills have to cross over to the other chamber, they have to be voted on, heard in committee, and voted on, most legislators have a crossover date. So your piece of legislation, your item, your bill, has to finish one whole chamber and make it over to the other chamber by a designated time or date, actually a designated date that's been decided on by the legislative leadership. If your legislation does not make it over in that time frame, then it dies, and you have to start all over in the next full legislative period. So often you'll hear folks that the legislators talk about the crossover deadline. And then you want to have an agenda or legislation that can cross the aisles, and I've mentioned that's playing in the sandbox together, but that's really bipartisan efforts. Certainly access to health care and affordability issues are something that should cross the aisles on either side of political parties. The interim period is an important one to know about. That's the mistaken vacation. That's when the legislature is not actually in session, but it's the period between sessions when studies are done, when relationships are built, when we work hard to build collaborations. And then the next term is the LRC. That's the Legislative Research Committee. Not sure. Often there's summer assignments. When we were in school, we had projects to do. Well, this is the ultimate summer assignment. This is an opportunity to participate in the research that goes on before legislation is introduced, often before bills are pre-filed. And the last one that I mentioned here is a sunset provision. If you hear someone mention that, that simply means that there is a specific time frame attached to the legislation that's being debated, that it's going to expire at some point. So that's what a sunset provision is. So now a little more on actually being an advocate, now that I've shared some of the time the terminology with you. The constituent advocate provides local relevance and accountability. My father was a salesperson in Eastern North Carolina, and he often said that if he sold to someone and they didn't have a good experience, that directly affected him. So when you're talking as a constituent, that person that's in the neighborhood, and you're having an experience with your senator or your representative, that directly affects that senator or representative, unlike a commercial can or unlike a person from a national organization. You are that constituent that's in the community. Provide real-life examples, access to information, public relations opportunities. That's when they kiss the babies and shake their hands and get caught on camera nodding their head, understanding and showing compassion for your issues. And most importantly, the constituent advocate provides a vote, and then they influence additional votes by talking to the people in the community about their experience.
Sorry, this is Caitlin. Someone needs to put their phone on mute, please. Thank you. We'll have questions at the end, and you can unmute after that.
Thank you, Caitlin.
You're welcome.
The effective constituent is also important. That person does their homework, you know, both sides of the issue. That's where Pam and Caitlin and their colleagues come into play by providing specific information and resources so that you understand both sides of the issues and can talk about the impact of legislation. That person lives in the district. They understand their importance. Almost the first thing you want to say when you walk into a legislator's office is, I live in Harrisburg, or I live in Cleveland, because you want them to know that you're a person that can vote for them. That person always has an elevator and a stairwell story ready. You want a long version of your spiel and a short version of your spiel. You want to be able to introduce yourself and say where you're from and talk about your specific issue very shortly. I'll share with you, I've had two distinctly different experiences in having to have an elevator and stairwell story. My worst one was having to climb 6 flights of stairs while talking to a legislator about the importance of the issue that I was advocating on. And in another situation, the legislator told me that I would have to walk and talk with him at the same time. He ended up being on his way to the men's bathroom, where I waited for him to come out to finish the conversation. So you never know what situation you're going to be in when you provide your story, when you provide the relevant issues that you're there to talk about. But you can have a long version and a short version ready. You should know who you're visiting. Are they a Republican? Are they a Democrat? Have they just gotten in office? Are they a freshman that's new and ready to hear about new issues? What are their key committees? Are they on your health committee? Are they on the insurance committee? Or is their office mate on the insurance committee? Again, when we have strategic planning sessions, when we have the legislative days, Pam and her counterparts, they do a great job of providing a lot of this background information. You want to know where that person stands on the issues, and have they been a sponsor, or have they co-sponsored one of the critical bills? And really important, you want to know how much time you have when you talk to them so that you can really be strategic in your conversation. Assume, as you plan, that you're just going to have 15 minutes with that person, so you want to be concise. You want to be prepared for schedule adjustments. You may have to wait, or they may be a little longer. I know when we were in Ohio, we dropped in on some folks that had time and had really good conversations with them. If you're in a group, you want to make sure you know who the lead is on your issue, who's going to be the spokesperson, and even practice it if you have an opportunity, if you're with a group that's doing advocacy together. And you want to be ready with your real example and the impacts that are on the people in the district. And lastly, you want to have your specific ask. We would like for you to vote for Bill 23, or we'd like for you to co-sponsor, or we'd like to become a resource for your office on healthcare issues. That's always one of the most valuable places to be, is a resource so that you're in that part of the brain for the legislator that we mentioned before. And lastly, meeting etiquette is so important. Taking the time to thank them for taking the meeting, again, emphasizing where you're from and what you do in the district. Ask about the staff's background. Make a connection. I'll never forget when Dr. Flood went to Ohio. It turns out that he and the Senate Majority Leader went to the same high school somewhere up north. But make that connection, and they're more likely to help remember you. That helps them to remember you, and then, of course, your issue. Thank them for what they've provided. Conclude with reminding them of your concise message. Certainly avoid being confrontational. Sometimes when you're talking to a legislative office, they may have opposed the position. They may have decided that it costs too much to insurance companies to stop step therapy. But what you want them to be able to say is that someone from their district came to talk to them about the issue. Oftentimes, when there is not a constituent advocacy, we hear legislators say, well, I haven't heard from anyone that I know that this is important, so I didn't vote for it. One of our goals is to take away their ability to say that they have not heard from their constituents. And then lastly, you want to practice active listening. Oftentimes, especially when you're meeting with staff, they'll share with you, well, if we just had additional sponsors, or it might be heard in committee next week, so there might be an opportunity for testimony. You want to listen for those opportunities to continue your advocacy and see what your next steps might be. This is one of my favorite slides. I grew up in politics, and I always heard people say that politics were horrible, which is a lot of pork, people bringing home special projects, and mudslinging and talking about each other. And I also wanted to make sure that you all are also looking at my slides, but it's really not. It's not pork and mudslinging. It's real issues that affect people. It's making sure that people have access to things they need. It's about healthcare affordability and access, and I think the work that the Arthritis Foundation is doing is extremely important. And the constituent advocate, the person in the community, in the grocery store, at the church, is the person that elected officials need to hear from to share their story. So some quick do's and don'ts, and I will share with you, I look forward to hopefully a question and answer period, because I think sharing experiences and asking questions about how to get your message across is extremely important. So I hope you all have some questions. I kept my talking brief to hear from you all. I've been doing this over 15 years, and every state is a little different, but the voice of the constituent advocacy is most important. So some quick do's and don'ts. Do try and arrive early. Maybe I'm saying that because I get lost going so many different places, so I try and get there early and be flexible. Don't be surprised if your meeting is on legislative time, meaning that your person is late, or they combine two meetings into one and you end up talking in the hallway. So you want to be flexible. You do want to personalize the issue. Let them know that this issue relates to their district. Don't give them too much personal information. Don't take your personal health information and your personal medical records to the meeting, because while this is about you, it's not just about you. It's about many of the constituents in your same position. You do want to share your passion, but you don't want to get into a debate. Understand the value of staff time, going back to my legislator's brain. If you recall, staff has a voice too that they're listening to, and so that's certainly the person the legislator's hearing from. So oftentimes it is just as important to meet with that legislator as it is to meet with the legislative staff as it is to meet with the legislator. Make sure you don't leave without confirming your information will be shared with the member, though. And then you want to follow up. You want to become that resource, but you don't want to stalk the member. You don't want to call too much or be seen as a nuisance. You want to be a resource. So those are just some quick things to share with you lunchtime on a Monday about how important it is to be a constituent and to be an advocate, and the importance that you represent for all of your elected officials. So Pam, I'm going to turn it back over to you. I hopefully didn't speak too fast to take any questions or whatever our next steps are.
Absolutely. Thank you so much, Starla. I really appreciate excuse me, your information, and I personally learned a lot, and I hope everyone else did. Are there any questions? Caitlin, is anything particular we need to know how to get them by?
Oh, you just have to, someone asked if they can get a copy of all these slides, Starla?
Oh, sure. I think Pam has a copy, so that's fine.
So I can send this out to everyone after the webinar, so you can have the slides. Also, it's been recorded, so we'll have it up on our YouTube page at some point.
Great, thank you.
And just remember to unmute your line if you have a question for Starla.
I don't have any questions. This is Kirsten. I just wanted to thank you for the opportunity to learn more about it. It was very well done, so I appreciate it.
This is Ann Powell with Johnson & Johnson Healthcare Systems. I want to compliment you. I really liked, I've been doing this for 12, almost 13 years as from a policy perspective, and I've really enjoyed in felt the way you presented was very concise and very easy to follow. So I thought it was very beneficial.
Oh, thank you.
Mm-hmm. And I would like to send you some information on the Virginia biosimilar legislation because that was passed in 2013.
Okay, great.
Mm-hmm.
And could you also send that to Pam?
Oh, certainly. I'd be glad to.
Thank you.
Mm-hmm.
Someone has a question. You mentioned a lot of bills that were introduced in 2014. Do you have an idea of the landscape for 2015?
Sure. I think we'll continue to see lots of activity as it relates to biosimilars and step therapy and specialty tiers. Sometimes step therapy and specialty tiers have ended up in bills together with some of the language, but I haven't seen as much that's being proposed for prior authorization. Doesn't mean it's not going to happen because many of the sessions will start back, again in 2015, but definitely biosimilars, I will continue to see a lot of the states considering legislation there because the approval will be coming forth and the debate will continue to be a lot between communication back to the prescribing doctor.
I'm going to, excuse me, this is Pam. I'm going to add a couple things to that, Starla, if it's okay with you.
Sure.
In Kentucky, though, House Bill 578 died because it was the end of session. Someone will be reintroducing that and hopefully will be in the 2015 General Assembly. In Michigan, we know that there is a bill currently that Senator Robertson has introduced that is a high copay, high out-of-pocket bill for medications to cap that copay. That probably will get nowhere this year, but he is planning to reintroduce it in 2015. In Ohio, we know that there will be more than likely a prior authorization bill probably coming out from Senator Olslager's office. And we have 3 people that are willing to be primary sponsors for a high copay cap bill. We're not sure exactly who's going to do that yet. In Pennsylvania, the study bill has been released. We do have some information that it would benefit to have a high copay, high out-of-pocket bill there. They're approaching the people who did the study bill to see if they're interested in sponsoring that bill. There is still a bill pending for biosimilars. And in West Virginia, I did not know that there was a biosimilar bill, so that's why I'm really interested in seeing that. So that's kind of an update as of...
Oh, I meant Virginia. I'm sorry. Did I say West Virginia?
Oh, okay.
I apologize.
Did not know that. That's okay. Thanks.
Pam, we should also add that we have built coalitions in I think Kentucky and Michigan, and so we've brought together quite a few stakeholders in pretty much in 3, if almost not 4 of the states to continue working on the issues. So we're doing that together.
Yeah, and that's pretty exciting. There are actually over 60 patient and provider organizations in the Kentucky Coalition. There's approximately 25 in the Michigan Access to Medication Coalition and about 20 in the Ohio Access to Medication Coalition. And we partner in Pennsylvania on the PA Against Specialty Tiers Coalition.
I don't have any more questions from the chat.
Okay, great. Well, thank you, Starla, and to each one of you for spending your lunch hour with us. We're looking forward to a very busy legislative year, as you can tell, and we hope you'll get involved in your state. You can recruit new advocates in your family and community. Contact the Arthritis Foundation near you if you can help recruit advocates at the Jingle Bell Run. Participate in a legislative day at your capital in 2015, or get to know your own state legislators by attending town halls or scheduling a legislative visit. If you happen to have a high out-of-pocket cost for your medications, we need those stories, and you can contact me at pfields@arthritis.org. Right now we have an article pending for USA Today, and we're trying to collect some great stories. And if you're willing to do that, we'd appreciate it. Finally, and this is my last comment, please get out and vote. Thanks and have a great day.
Thank you, Pam.
Thank you.
Thank you. Thank you.